pink eye infections are sitting at over 20,000. That's according to the latest update from the KZN Health Department. Now, pink eye is the inflammation of the membrane that lines the eyelid and eyeball. The first case was reported at the Mangosuthu University of Technology in eThekwini district. This was in February. The province is expected to welcome a host of travelers naturally during the Easter weekend. But let's get an update on the current number of infections from the HOD in the KwaZulu-Natal Department of Health, Dr. Sandile Tshabalala. Dr. Tshabalala, good morning to you. Thank you so much for joining us. I've got 20,000 recorded cases on my end. What number are you sitting with as KZN Health?
Good morning to yourself and good morning to the viewers of your show. We, up to yesterday, had recorded 20,781 new cases as a province. But remember, these are cases that we have been able to diagnose. We are saying possibly there are other cases that have not been recorded because some people do not just jump for treatment immediately they are infected. So that is the number at the moment that we are having as a province.
And so you believe that there's quite a likelihood that that number could be bigger, considering that some people may not even approach a health facility?
There is a very good likelihood that the number is higher. Remember, the number, the 20,781 is mostly in eThekwini. More than 20,650 is in eThekwini. And then the other districts, you see few cases. But these cases, there is a time where after the 29th, they seemed to be going up in other districts of our province. But then the reporting of those numbers went down. So we are thinking other people are not coming up for one or other reason.
Okay. What do we understand the reason to be that we're seeing such high numbers? I mean, 20,000 in eThekwini, and then King Ketwayo, Ugu, Umkungundlovu, Ilembe, all of them having cases as well. What's the reason?
Remember, the population of eThekwini, the population of KZN, according to Stats SA, is more than 12.4 million. About 4 million or so of that population is in eThekwini. So the square meterage per person means people are very close to each other. The spread of conjunctivitis is from hand to eye. And when people touch, when people sneeze, cough to each other, that is the potential reason why the numbers are high in eThekwini. Okay. But also the fact that most people will come to eThekwini for any activity. You may find that is among other reasons why it started in eThekwini, then it went to other districts. We are not necessarily saying that is the case because science must prove that, as we have taken some of the specimen. Cause, is it viral, is it bacterial? Then we are able to manage it much better than we are doing.
But surely at this point we know what causes conjunctivitis. Surely as the Department of Health, instead of just waiting on organisms to be tested, what do we know about conjunctivitis at the moment? Essentially what I'm trying to get to is, yes, it's spread through hand to eye and then and moved through close-knit communities, and that's why the high numbers in eThekwini. But what's at the root of it? So how did we get conjunctivitis in KZN to begin with?
That is exactly what we're trying to find out by taking the specimen to the laboratory, but also by assessing the communities where we are finding the conjunctivitis. We find it at schools. We find it also in the community. If it was schools only, we would have easily said maybe one child got it from home and then it got spread at schools. But the fact that it's in the community, it then becomes difficult to say exactly what was the source of this. And the fact that we still do not know whether is it a viral or bacterial or other irritants makes it even more difficult for us to give you a conclusive answer to that question.
Could it be as a result of the high levels of E. coli that have been recorded in some of the waters in KZN? I mean, it's commonly known that since the advent of the 2022 floods in KZN, E. coli has been quite common, particularly on Durban's beaches. Could that be a reason?
We would need a scientific proof of that. However, we want to state it clearly. Most of the time, if it was a virus, we would expect adenovirus. But if it was bacteria, we would expect bacteria other than E. coli. So it is unlikely, according to my understanding, that it is E. coli, but we still have to get the scientific proof of what exactly is the cause.
Yeah, I mean, it would be very worrying, and we'd need to get those answers very quickly, particularly as we head into this weekend as people are traveling towards KZN. If it is E. coli, and just to assist our viewers here, E. coli is essentially a bacteria that feeds on feces. So if that is the level of contamination in the water of KZN, that would be very concerning. Are you then speaking to other departments around the environmental issues that could be at play here, and doing so urgently as we get closer to the weekend as the numbers flock to KZN?
Remember, E. coli, as we are saying, will be more in the gut, the gastrointestinal system. And there have been people, you remember that there have been rallies in the province, and people have been to the beaches in the province, particularly at eThekwini, and there have been no increases of gastrointestinal diseases that have been reported. So the issue of coli, I would want to believe that the work that was done by eThekwini district has managed to clear that from the system, environmental system that is. And as such, even now, we do not expect that it would be that E. coli. If it's E. coli, we would not want to relate it to the E. coli you're talking about, simply because that E. coli you're speaking about was reported before even the festive season holidays, and festive season holidays came and went, and we did not see the increases, and therefore we are not really linking the two. But the other scientific aspect is that most of the time when you get conjunctivitis, it would be a virus, mostly adenovirus, bacteria, any other kind of bacteria, staphylococcus, some sexually transmitted virus, bacteria as well, and other irritants, not necessarily E. coli. So I do not think the two do link. However, when the laboratory tests come back, we'll be able to say, here is the main virus, here is the main bacteria, or the irritant. Because even in some instances, you find people who have allergies. Remember, the change of season, the change of climate can contribute. Fungi can contribute as well. So we still do not know, and we cannot commit to the department and say, probably it would be wrong of us to do that.
But again, I'm asking about your interaction as the Department of Health with departments such as environment, which departments such as water and sanitation, to see if contamination could be an issue, whether we link Pengai and E. coli or not. And I know that there you need to wait for the lab to come back to you. But what sort of interactions are you having with those departments, considering that this has been an issue? I mean, in previous festive seasons, we've seen the Durban local government needing to close some beaches because of high levels of contamination. And this is, we're very much aware of this. So what interactions are the departments having to stay on top of things?
You're very correct. We are in contact with the environmentalists in the different municipalities, and if you check very well, the municipalities that are affected are more coastal, and as they are coastal, we speak to all of them in terms of the environment. We speak to water and sanitation, particularly in eThekwini. They have checked. So far, they've not found any of the bacteria, including E. coli, in the water, and therefore that is why I'm comfortably disputing that. We also are speaking to other departments, social cluster departments, to say, can we be able to go towards locating the source of this so that we nip it at that level and try to prevent the spread going forward. Okay.
I just want to bring this up because I'm looking at reports here that it was in February when a water can representative, Jonathan Erasmus, is quoted as saying that it is talking about the E. coli problem. It is an extremely worrying picture, indicating that the city's residents will be facing this problem for months, if not years, to come. That's in an article that by IOL. So we can leave it there. Let's talk about how we start to protect people. What is it that we say to those that are traveling to KZN about how they protect themselves from getting pink eye?
You remember the old adage of prevention is better than cure. We are promoting that adage. Among other things, we are saying if you have pink eye, if possible, try not to be among other people. Secondly, treat it as soon as you can, irrespective of whether you know the cause or not, because it can be treated symptomatically. But also the issue of using sanitizers and washing your hands after you have used them, either in your eyes or anywhere else, it is very, very critical. When you cough, remember it was introduced when we were talking about TB, the issue of coughing into your elbow. Let's go for that rather than coughing into your eyes. However, we are saying we appreciate that many people and many churches will be getting together. These preventive measures must be implemented so that the spread is not only reduced in the province, but it's prevented from spreading to other provinces, as we expect more people to come into our province.
All right. Well, we really do appreciate your time, and thank you so much for speaking to us. Dr. Sandile Tshabalala there, HOD with KZN Health, bringing us the latest, of course, and giving us some tips on how to protect ourselves and also get treatment. That's after reports of over 20,000 cases of pink eye or conjunctivitis have been reported in KwaZulu-Natal.